Waldenström's is an incurable condition, and patients will be treated many times during their lifetime. And as it's an incurable condition, then more treatment options are always a good thing. So I think currently we do have chemoimmunotherapy, which is a good big group of treated patients. And now we have BTK inhibitors, including Bruton and Dana-Farber. But what happens when we have used all these two agents and then we need to treat the patients, that have already received these agents? So the data on that group of patients is actually much more limited. And this is where Venetoclax could come into place. Venetoclax is an oral agent, a non-chemotherapeutic agent that is has a mechanism of action that is different than the ones that we already discussed. It's an anti-BCL2 inhibitor. And in that specific sense, blocks a pathway that allows malignant cells, including Waldenström cells, to immortalize themselves. So actually induces cell death in these patients. So basically induces the effect of chemotherapy without being exposed to chemotherapy, which is a good thing. So Venetoclax has already been approved in the United States for a couple of different types of leukemia. And based on the fact that patients with Waldenström cells do have expression of BCL2, then Venetoclax make actually sense, scientifically speaking. So we started patients on 200 milligrams for a week, and then we went up to 400 milligrams for a week, and then 800 milligrams for 2 years, with the idea to stop therapy at the end of the 2-year duration. We enrolled 32 patients, and the response rate on these patients was about 84%. We were aiming at 70% or higher, so 84% actually exceeded our expectations. And the very good partial response was about 19%. So nice responses, deep responses. It took about 2 months, maybe 2 and 3 months to get a response to Venetoclax, so a little slower than compared, for example, with ibrutinib, that within 4 weeks most patients are responding. And up to say, I would think the 2-year mark, more than 80% of patients had not progressed yet, so very effective regimen. But then when we stopped therapy at the 2-year mark, we started seeing some events of progression right after that. So from all the patients that progressed in the study, about a third of those patients actually progressed during the 24-month and the 36-month, which is the time after treatment was stopped. So that gives him an idea that Venetoclax is a very effective agent. The side effect profile was very manageable. We did not see any neuropathy, no IgM flares, no IgM rebounds, no myeloid neoplasms, no withdrawal symptoms. So we saw some neutropenia, which is expected with medications like these that we manage promptly with some growth factors. But despite the fact that it's effective and relatively safe, it looks to me that a finite duration treatments might not be the answer, but it really paves the way to optimize therapy with Venetoclax, maybe by combining it with some antibodies or combining it with a BTK inhibitor or other medication with a supplementary mechanism of action. I think we could develop a medication that is effective and could provide patients with a fixed duration treatment.